Hey guys and welcome back. My name's Kris and today I thought I would talk about why doctors are always running late. This of course is not to say that every doctor everywhere is always running late, but it is a complaint I hear quite a fair bit, both as a doctor and as a person in society. So now that I have a fair bit of insight into the workings on both sides, being a patient and a doctor, I thought I'd cover a couple of the more common reasons why your doctor may be running late. So if you think this will be interesting, please keep on watching. I think it's really important to start off by realizing what a doctor's day is actually like. So when you work in general practice, your life revolves around an appointment book. Think about those old school diaries or your old school timetable where certain blocks were certain things. That's what it's like being a GP. So at 8 o'clock I'll have patient 1. At my practice, our appointments are 20 minutes long, but every practice has its own thing. I've worked in practice where every consult was 10 minutes and 15 minutes and now 20 minutes. There's a lot to be said for the philosophy behind all of those, but for argument's sake, when I talk about an appointment time, that's 20 minutes, and a long appointment is 40 minutes. I highly recommend that you ask your general practitioner or their staff members what a normal appointment time is like in your general practice, because it does vary and it may make a little bit more sense to you. Our lives revolve around that appointment book. So, typically, our appointment books are open all the time. At my practice, you can book by phoning us or booking online. Mind you, COVID has changed a couple of things, but I'm talking in general outside of the pandemic. When you call for an appointment, you'll be asked if you want a standard appointment, which is a standard 20-minute consult with us. If you're a new patient, aka you've never been to the practice before, you will need to have a double appointment, so 40 minutes. This is so that the staff can get to know you and your medical needs so that we can tailor your care to you personally. Quite often at my practice, that means that the nurse will see you first and take a set of vital signs, including your height, your weight, your blood pressure, and your heart rate, as well as get any medical history, including what medications you're on, allergies, and that sort of thing. It really helps when I, as your GP, know the basics about you so I can tailor my advice to you. So if our appointments are 20 minutes long, that sounds like such a long time, doesn't it? I'm just going in for a script. Why do I need 20 minutes? Can't I make a short appointment? The answer is yes and no. Some clinics have script clinics for those sorts of quick in and out, just want to repeat. But the thing is, in general practice, there's no such thing as just a script. You might think, I've been on the pill for years for contraceptive reasons. Can't I just go in and get it? No, it works for me. I'm not pregnant. I remember to take it. But the thing is, I and your GP will be thinking over several things before we sign our name on that script. Are you getting regular periods? Are you iron deficient? Do you have migraines? And therefore, do you have an increased risk of having a stroke if you're on an estrogen-based pill? Is there another option for you? Is your weight putting you in a category where it's risky for you to be on an estrogen-based contraception? Those sorts of things. So when you come in for just a script for the pill or whatever, we need to consider your blood pressure, your height, your weight, other medications you're on, and your personal needs. You may not know that there are other options. If you're on the pill and you're still getting heavy periods, and we didn't ask those questions and you just wanted a script to get on with your day, we may not have that life-changing conversation about methods to reduce the heaviness of your periods, investigating why you're getting such bad periods, and so on and so forth. Mind you, that's one example out of many, but it shows you how very quickly a very quick consult turns into one that does need that 20 minutes. But I haven't covered why doctors are late. There's a multitude of reasons, and I'll try and address them in a category type way, so doctor factors, practice factors, and patient factors. Bear with me. So doctor factors. Remember, at the end of the day, we're people. We're people and we need to deal with things too. We need to use the toilet, to eat our lunch, to take phone calls, to look after our patients and to give you the best care we can. If our day was simply 8 to 8:20 patient A, 8:20 to 8:40 patient B, and so on and so forth until 5:30, we would be burnt out. Sometimes, and this is more of a patient factor, but I'll put it in the clinician factor part, our patients will be much more complex than what we can deal with in 20 minutes. But it is our duty and the duty of care that we have to give the best care possible to those people in the time we have. If you came in with a sore toe and I realized that you had a massive infection, and then we got to talking and I realized that you might be diabetic and that you've never had your heart checked and things like that, sure, I can give you a script for your toe, but it would be negligent for me not to address all those factors at once, or at least have the discussion so you could come back. So suddenly a very quick consult for a sore toe or an affected toe becomes organizing blood work, chasing previous pathology, chasing previous specialists perhaps, writing referrals, further investigation in the practice like an ECG or spirometry or what have you. It's very easy for things to get out of hand, but that's what we're trained for, and that's what makes general practice so good, is that you might come in with one thing, leave with another, but the thing is, I'm doing it because I care about you and I want you to leave in the best health possible. So yes, one of the reasons we run late is because we see something and we realize there's a whole plethora of things underneath that surface that we want to address. The second thing I've kind of mentioned is getting phone calls and referrals from specialists. So when we refer you to, say, a cardiologist for a heart problem, that cardiologist will send us letters back. These letters can come back at any time of day and quite often pop up in our inbox. However, that's not always the case, because sometimes the cardiologist, again, this is just an example, will want to call us about you whilst you're in the cardiologist rooms. Is this medication up to date? Were you aware of this? Do you have a previous ECG I can use to compare? We can't, in good conscience, say no to a specialist calling us about our patients, because we still have a duty of care. And it's also very difficult for us to communicate, because in outpatient scenarios, not inpatient, although this also counts for inpatient, we don't know if the person at the end of the line has a free moment in 5 minutes when we do. So we take the phone calls when we can. I know how rude that is when you're the patient and the doctor takes a phone call about someone else. I get it. That time space, you booked that for you. But you would want to have your doctor answer the phone if you were on the other side with the specialist. So it's kind of a bit of give and take, but trust me, I get it. And I'm always so profusely apologetic to my patients when I'm like, I've got to duck out, I've got to take this phone call for, another person. I recently had to take a phone call in the middle of a consult because I got a phone call from a path lab about a COVID result. It was negative, but there was something else going on there as well. So, I can't in good conscience say, I'll call you back, I'm busy, my next break is at the end of the day, because I'm booked out. The third reason we run late is ish hits the fan in general practice more often than I think any one of us would like. In my GP career, which has only been 18 months, I have performed CPR, called dozens of ambulances. I've had to give IV fluids emergently. I've had to take walk-ins who are bleeding from the face so I can suture them up. Ish happens. And the thing is, as a doctor, it is my duty of care, which is a statement I keep repeating, to care for you when you come in. Emergencies happen, and in general practice we are equipped to deal with a certain level of emergencies. You cut something open, yes, I can stitch you up. At least in the practice I'm in with the skill set I have, yada yada yada. If you come in and you can't breathe, my patient with the pill script is not going to die if I spend half an hour making sure that you don't perish. So that's the kind of give and take, the kind of pro and con that I have to weigh, the risk and the benefit of caring for one patient or the other in that time frame. So you can imagine I'm running smooth on time, it's 10:40, I'm calling my 10:40 patient, and then a guy comes in and collapses on the floor. Depending on the number of people in your practice, that could mean that you have to get involved. I've worked where it's just me and one other and we've had to do CPR. It's terrifying. You had a good outcome. But you run out and you do it. And the thing is, patients, if you see that your doctors are doing CPR, of course you're gonna be like, no, that's fine. But we're really, really good at keeping things private, pulling people into back rooms, doing things outside of the waiting rooms and visual scope. So you might not have any idea what's going on in the back. And that's okay, you're not supposed to. But the next time you're sitting in your waiting room and you're thinking, oh, Dr. Kris is half an hour late, what's going on? Maybe it's a good thing that you're not the reason she's running half an hour late. Then we come on to practice points. So the practice is the building that we work in, the business we work for, and quite often we will have meetings. And sometimes there are really important things that we have to talk about. Incidents that have happened, complaints, compliments, they're nice too. Changes in protocols, especially like during a pandemic. Thank you, COVID. Our meetings we structure in as appointments, which is a bit of a loss for us because we make no money from having a meeting while seeing a patient we do, but it's vitally important. Of course, I don't know if you've ever been to a meeting that starts exactly on time and finishes exactly on time, because I sure haven't. Sometimes the receptionist will get a phone call with a question and they have to ask the doctor. There's someone on the end of the line, a patient, a pharmacist who needs to talk to us, but we're in the middle of a consult or just between patients. Yep, quick phone call, it adds minutes. And minutes count when you've got an appointment. I think it's really important to note here as well that if I'm running 15 minutes late, that does not mean that you only get 5 minutes of my time. You will get the full 20 minutes. Finally, there are patient factors too. Sometimes people come in and they don't realize what they really want from us until they're there. And that's okay. For example, I've had people who have come in with abdominal pain. My tummy's not been right for a couple of weeks. And what they really want to talk about is their sexual assault. I've had people who have come in with a career UTI, and it turns out it's an STI. And they're really embarrassed, or it's really sensitive information. I might be having a day where I'm absolutely on fire and I can watch you and type and listen all at once. And sometimes I need to slow down too to really comprehend what's being said. This means that I might be 5 minutes late for my next patient. Moving on from that as well, sometimes I'll need 5 minutes after a consult to recenter and to compartmentalize that consultation so that I can go in with fresh eyes into the next one. GP is amazing in how diverse it is, but it can be very jarring, going from a kid getting a vaccine to someone coming in and telling me about their suicidal thoughts, to a couple who just got pregnant, to someone who's had chronic kidney disease and needs a new referral, to someone who, you get the idea. A lot happens and it all happens bang, 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 bang. Very rarely do I get a whole morning of women's health, a whole afternoon of kids, a whole morning of mental health, a whole afternoon of surgery. It's so variable and I love it for that, but it does mean that sometimes I run behind. And the final thing, and the thing that gets my goat the most, is when patients are late. I get it. I'm a person. I have been late to a doctor's appointment once or twice in my life. I don't see a doctor that often because I'm healthy. See your doctor if you need to. But when you run late, we need to shorten our appointment because your tardiness cannot impact on the next person who is on time or if not early. If your appointment's at 12 on the dot to 12:20 and you arrive at 12:10, I can only really give you 10 minutes of my time because I've spent 10 minutes waiting for you. Of course, if you come in and it was something, say there was an accident on the road and you were stuck in traffic, I get it, but unfortunately I can't control that and nor can you, and we may have to reschedule for a second appointment. Likewise, if you come in and you've got 5 minutes to spare in your appointment, but it's a really long consult for one reason or another, I will do what I can in the very limited time we have together to give you the best care. But it may be that I go and say, look, we need to come back and revisit this at another time when we're actually given the full appointment time. Because that's another reason we run late, is if you run late, the appointments run late because I want to give you the best care possible. Then my next appointment's late and then the next one and you get the idea. The doctors run late for a lot of reasons. Mostly it's because we're human. We're not machines. If machines could do all of our consults, we would live in a very different world. You don't have that compassion with a machine. You may have the quick diagnostic tool and you may have a quick typist and you may have, someone who can spit out yes or no answers very quickly with a machine. But you don't have the compassion, you don't have the facial expressions, you don't have the empathy, the sympathy, or the human factor that makes medicine so beautiful. So yes, we've all run late, and I can tell you now we don't mean to. We don't sit there and go, ugh, I don't want to see that person today. I'm going to run 15 minutes late so I only get 5 minutes with them. I can guarantee you that's not happening. So the next time that you're sitting in your doctor's waiting room and they're running late, try not to get grumpy, especially not at the reception staff. They've got no control on our actions. Do not get grumpy at our nurses either. We need to keep our staff happy because we're a team. If one of us is affected, all of us are affected. I would love to say the next time that your doctor's running late, be thankful it's not you, but that's not the message I'm trying to convey. There are so many factors that go behind it, and just because our appointment book is there doesn't mean that we can stick to it like robots. So remember, be kind to one another, be kind to your workmates, be kind to the people that you see for their expertise and their knowledge, including your doctors and your electricians and your plumbers and your farmers and so on. Everything that I say is for education and entertainment purposes, and just because I'm a doctor does not mean I'm your doctor, and everything I say is based on my experience more than anything. So if you have questions, let me know and I'll try and give you a general answer. But until next time, guys, stay safe, stay hydrated, and let me know what you want. Lamest ending ever, but hey, see ya.